Hello dear students, one more time. Let's continue our lecture about signs and syndromes of endocrine disorders. And now I'm going to discuss with you disorders of endocrine pancreas. First of all, I want to ask you to do some activity. Under my lecture in comments, please write your names and groups to check is somebody listen, is somebody attend my online lecture. And here you see picture of our group in Facebook. It is closed group just for students and teachers, where we can make some discussion. If you have questions, if you have some comments about my lectures, maybe you want to discuss something else, you need some extra materials, I upload the link to my YouTube lecture in our closed group, and under it in comments in Facebook, please ask your questions and write all your comments about our lecture. Me and all teachers of our department will be glad for some your activity. Okay, let's start about endocrine pancreas. First of all, let's remember a little bit anatomy. Pancreas placed near the duodenum, under the stomach, and in the left side, it bordered by spleen. It get blood from splenic artery, yes, and have a system of pancreatic ducts. Yes, you remember from GI cycle that it have exocrine function, and today we're going to discuss its endocrine function and its problems. Okay. Primary endocrine functions. It is production of pancreatic hormones by three cell types: glucagon by alpha cells, insulin by beta cells, somatostatin by delta cells. Hormones travel through the bloodstream to target tissues and target cells. Hormones bind specific receptors and cause cell changes that control metabolism. Okay, two hormones, insulin and glucagon, they keep one balance and regulate each other's. Effects of insulin: it is increase glucose oxidation, increase glycogen synthesis, increase fat synthesis, and increase protein synthesis. And glucagon, it is one of group of anti-insulin hormones. Yes, it here include another hormones, but in pancreas it's produced just glucagon, and it has opposite effects from insulin. It increase glycogenolysis, increase gluconeogenesis, and ketogenesis, and both these hormones always have to keep some balance, to keep on the same level, normal level of glucose in blood, and metabolism of other chemicals like fats, proteins, and others. Okay, insulin. It is a polypeptide hormone composed of two chains, A chain and B chain. Both chains are derived from proinsulin or prohormone of insulin. Chains are joined by disulfide bonds. Okay, acts on tissue is increase uptake of glucose and amino acids. Insulin increases glycogen production, glucose storage in liver and muscle. It stimulates lipid synthesis from free fatty acids and triglycerides in adipose tissue. Also stimulates potassium uptake by cells, role in potassium homeostasis. Chemically, high levels of glucose and amino acids in the blood. Hormonally, its beta cells are sensitive to several hormones that may inhibit or cause insulin. And neurally, it is stimulation of parasympathetic nervous system caused by insulin to be secreted. It is three main mechanisms of controlling of insulin secretion. Moreover, this controlling is decreased by decreased glucose and increased by increased insulin concentration in blood in sympathetic stimulation. Insulin transported through the blood to target tissues when it binds to target cell-specific receptors and acts as a biochemical signal to the inside of the cell. Cell metabolism is stimulated. Okay, how to check for screening normal insulin level, we have to check blood fasting glucose levels. The normal range of fasting glucose is about from 3.9 till 5.5 millimoles per liter. It measured by fasting glucose test. Hyperglycemia, it is high levels, more than 5.5. It can be short-term, it's physiological, after meal, or it can be pathological due to abnormal carbohydrates metabolism. And it can be persistent. It is impaired in prediabetes and high level of fasting glucose in diabetes mellitus. And it can be a low level, less than 3.9, we name it hypoglycemia. Okay, purpose of investigation of patient with endocrine pancreas disorders. It is general evaluation of health. It is diagnosis of disease or disorders of endocrine pancreas, diagnosis of other systemic diseases that affect endocrine pancreas. Okay, what from patients interviewing we are interested in? Gathering of information, patient's narrative, biomedical perspective, psychological perspective, and context. In clinical tests, more of blood tests, we should check blood pressure, management of hypertension, monitoring of levels of blood pressure, because hypertension, it is a risk of heart disease. It is obligatory eye examination in management and monitoring onset and progression of eye disease. And it is food examination with management of possible food problems like diabetic foot and monitoring onset and progression of nerve disease and peripheral artery disease. Okay, indications for testing for diabetes mellitus. According to American Diabetes Association, it is the most important diabetic association in the world, and most countries uses recommendation of this association. Yes, what indications to test for diabetes mellitus? First of all, it is obesity. We can say that it is high weight patient or obese patient when BMI is more than 25 kilograms per meters in square. It consider testing to detect pre-diabetes mellitus or diabetes mellitus type 2 in asymptomatic people. And I hope you remember that diabetes mellitus type 2 it is very gradual, and during long time, months, even years, it can be asymptomatic. And another indication, it is family history of diabetes mellitus in first or second degree relatives. It is signs of insulin resistance or conditions associated with insulin resistance, like acanthosis nigricans, like hypertension, dyslipidemia, low birth weights. It is maternal history of diabetes mellitus or gestational diabetes mellitus during gestation. And what test should we do to check is it present diabetes mellitus and its complications? First of all, as usual, on the first place, it is CBC, complete blood count. It is fasting glucose in serum or morning glucose level before breakfast after 8 hours without meal. It is oral glucose tolerance test. It is response of glycemia level on intaking of 70 grams of glucose. It is a random blood glucose. It is islet cell antibody test. It is important for type 1 diabetes mellitus. It is hemoglobin A1C or glycated hemoglobin and diabetic urine detecting of ketonic acids and glucose level into urine. The current World Health Organization diagnostic criteria for diabetes should be maintained. First of all, it fasting plasma glucose more than 7 millimoles per liter, or in milligrams 826, or 2 hours plasma glucose more than 11.1 after oral glucose tolerance test. It is glycated hemoglobin more than 6.5. It means for responsible for diabetes mellitus, and if it from 5.7 till 6.4, it's not normal too, but it says you about pre-diabetes or risk of diabetes. Glycated hemoglobin reflects average plasma glucose over the previous 2-3 months in a single measure, which can be performed at any time of the day and does not require any specific preparation, such as fasting before this test. Yes, why 2-3 months? What is glycated hemoglobin in general? It is usual blood hemoglobin from red blood cells that include some molecules of glucose. It's possible in case of rapid increasement like peak of glycemia. That is very usual for diabetic patients. And in this way, in this moment, some molecules of glucose come to hemoglobin. Yes, and is higher level of glycated hemoglobin as more episodes of peaks of hyperglycemia it was. And 3 months it is period of life of erythrocyte. That's why this test is responsible just for this period. Okay, and what markers are responsible for what situation? Yes, what individuals suitable for testing? It is non-pregnant, first of all, non-pregnant individuals with diabetes risk factor. Is it family history? Is it hypertension? Is it obesity? We do fasting glucose, 2 hours oral glucose tolerance test, and glycated hemoglobin. If all of them elevated, we interpret it like diabetes mellitus. For all pregnant women from 24 to 28 weeks of gestation. First of all, here we do 2 hours oral glucose tolerance test with 75 grams of glucose, and additionally to it, we do fasting glucose. If it is positive, if it is elevated fasting and after glucose, we interpret it like gestational diabetes, but just in case where it was no history of hyperglycemia before gestation. Okay, in diabetic urea analysis, we check glucose urea. It can be detected when level of blood glucose exceed more than 11 millimoles per liter. Urine test can't be used alone to confirm the diagnosis of diabetes mellitus, just in complex with blood testing. They are ordered more often when they are in suspicion of type 1 diabetes mellitus. And laboratories can test urine for ketone bodies. Another important sign in urine analysis, and positive for ketones, it usually in patients with diabetes mellitus type 2. To make controlling type 1. To make controlling type 1 diabetes mellitus more easy, today present in pharmacy keto strips. It is a very rapid urine test for presence of ketonic acids that patient can do individually, and according to coloration of these strips, we can check presence or absent ketones in urine. The body produces ketone bodies that fat tissue is used for energy instead of blood sugar. If ketone bodies are present in high level of glucose in blood with insufficient level of insulin production. One more time, presence of ketonic acids are possible just in case of insufficient insulin production. That's why it is just type 1 diabetes mellitus, or in some cases of diabetes mellitus type 2 but with secondary insulin deficiency. The most simple way to controlling diabetes in general, it is controlling of glycemia. Individual controlling of glycemia in patient, it is obligatory method for all patients with diabetes mellitus, as type 1 as type 2. To make it more easier, we have glucose meters that patient can use at home out hospital. Usually they look in such way like you see at this picture. For today, we have more modern way to monitor glycemia. It is continuous glucose monitors that contain subcutaneous sensor that measure an interstitial glucose levels every 1 to 5 minutes, providing alarms when glucose levels are too high or too low, or are rapidly rising or falling. Yes, it usually look in such way. You see that monitor, it is not a big device with very thin, very small catheter that injected subcutaneously into the fat, and it do a huge number of check-ins during day. It's nearly 288 check-ins during 24 hours. And all these check-ins you can see in your device, in smartphone or watches, and it makes some alarm when it is very high rising or falling of glycemia into the blood. That says that patient need to eat something or to inject insulin. Okay, what about diabetes mellitus? We have a lot of different types of diabetes mellitus, but main of them, most often in real clinic, it is type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes. What about type 1 diabetes mellitus? It results from the body's failure to produce enough insulin. Yes, it is insulin deficiency. Main risk factors of it is viruses and toxins that can affect genetically determined antigens or of HLA system and cause autoimmune destruction of beta cells in the islets of lung organs. And we have a little bit other situation in diabetes mellitus type 2. It begins with insulin resistance, a condition which cells fail to respond to insulin properly. Yes, if there was no insulin, here enough insulin, but sensitivity to this insulin is very low and effects from this insulin not enough. As the disease progresses, a lack of insulin may also develop. Yes, in type 2 diabetes mellitus, it can be secondary insulin deficiency. This form was previously referred as non-insulin dependent diabetes mellitus or adult onset diabetes. The primary cause is excessive body weight and lack of exercise. Yes, in more old literature you can meet that type 1 it is young diabetes, type 2 it is adult onset diabetes. But for today, this graduation is not actual because type 2 become younger, it still manifests often in more aged people, but today we see patient 30 years, even 20 years with manifestation of type 2 diabetes mellitus. And the opposite case, sometimes in endocrinological clinic we see patients who has manifestation of absolute insulin deficiency in adult age, because that's why, yes, type 1 mostly started in a childhood, but it can started in adult people, and type 2 it mostly adult onset diabetes mellitus, but it can be present in much more younger groups and even children's. And what about gestational diabetes? It is the third main form and occurs when pregnant women are very important without previous history of diabetes develop a high blood glucose level. Classical clinical symptoms of diabetes mellitus. Diabetes mellitus in general, not depending on type, has a very limited number of symptoms, specific symptoms of diabetes mellitus. And after it goes a huge number of different symptoms, but all of them are associated with different complications and depend what kind of complication can be in each patient. But specifically just for non-complicated diabetes, it's just several symptoms. 3 of them started from the poly. It is polyphagia or increased hunger, it is polyuria or frequent urination, and polydipsia, it is increased thirst. And additionally to it, it can be weight loss or weight gain depending on type of diabetes. Mostly it is weight loss for type 1 diabetes mellitus, and it is weight gain for type 2 diabetes mellitus. Other clinical symptoms, they even less specific. It is blurred vision, it is fatigue, weight loss, poor wound healing, like cut scrapes and others. It is dry mouth and dry and itchy skin. It can be important in male patients, and it is a recurrent infection such as vaginal ear infection, groin rash, or external ear infections, like we name it swimmer's ear. Early symptom. It is frequent urination, it is increased thirst, blurred vision, fatigue, headache. Yes, they are early symptoms for all types of diabetes mellitus, but type 1 it always manifests rapidly. That's why you can see it in several days. In type 2 diabetes mellitus, it even can increase started and increase during days, weeks, months, even years, because type 2 diabetes is very, very gradual. And more later symptoms, yes, but one more time, they are much more early for type 1 diabetes mellitus, it usually several days or weeks, and for type 2, it usually years. It can be ketoacidosis, that mostly usual for type 1, that manifests with fruity smelling breath, nausea and vomiting, shortness of breath, dry mouth, weakness, can go with confusion and even coma and abdominal pain. Okay, one more time by this picture, let's remind early symptoms of diabetes mellitus. Weight loss for type 1, for type 2 it is weight gain. It is extreme tiredness, increased hunger, excessive thirst, frequent urination, tingling and numbness, blurred vision, unhealed wound, and urine are touching ants. And by scheme, one more time, symptoms of diabetes mellitus. In more violet color, you see more common symptoms for type 1 diabetes mellitus. Central, one more time, it is polyuria, polydipsia, polyphagia. It can be lethargy or even stupor. It is blurred vision, smell of acetone for type 1. Gastric symptoms that more usual for type 1 too, it is nausea, vomiting, abdominal pain. Urinary, it is polyuria and glucoseuria. And respiratory, in severe cases we can see such pathological type of breathing like Kussmaul breathing or hyperventilation. Okay, and what about acute complications of diabetes mellitus? Acute complications of diabetes mellitus, it is diabetic comas. And one of the most often type of acute complication, it is diabetic ketoacidosis, and in most severe cases, it goes to ketoacidotic coma. It is a potentially life-threatening complication, happens in patients with diabetes mellitus type 1, but it can occur in those in diabetes mellitus type 2. I told about it, it is patient with secondary insulin-dependent diabetes. The symptoms usually evolve over the period about 24 hours. Predominant symptoms are nausea, vomiting, pronounced thirst, excessive urine production, and abdominal pain. Breathing in this case becomes labored and of deep, gasping character, like Kussmaul respiration. In severe cases, there may be confusion, lethargy, stupor, coma. On physical examination, there is evidence of dehydration, like tachycardia, low blood pressure, ketotic odor, and death. Blood analysis will reveal significant decreases of pH less than 7.3 because it is acidosis. Urine analysis will reveal significant levels of ketone bodies, often before other overt symptoms. Another acute complication, it is non-ketotic hyperosmolar state. Yes, fortunately, it is much more rare than ketoacidosis. Why? Fortunately, because mortality of this situation is very, very high. In case when it goes to coma, to hyperosmolar coma, mortality more than 80%. An acute complication sharing many symptoms with diabetic ketoacidosis but an entirely different origin. water osmotically drawn out of cells into the blood. The kidneys in this case eventually begin to dump glucose into urine. Serum pH more than 7.3, bicarbonates more than 15, small ketone urea and absent to low ketone amia less than 3. It is very high hyperosmolarity. It will be very high glycemia in this case, but without presence of ketonic acids in blood and into the urine. It is increased risk of blood clot formation in hyperosmolarity. If fluid is not replaced and patient not got adequate treatment, the osmotic effect of high glucose level combined with loss of water will eventually lead to dehydration of peripheral tissues. Some alteration in consciousness lethargy may ultimately progress to a coma. I told you it is very, very dangerous, very bad result. Okay, a life-threatening diabetes mellitus complication that causes consciousness. It can be 3 different types of comas. It is severe low blood pressure in diabetes mellitus person or hypoglycemic coma. It is diabetic ketoacidosis advanced enough to result in consciousness from combination of severely increased blood sugar level, dehydration and shock and exhaustion. And another type, we told about it, hyperosmolar non-ketotic coma, in which an extremely high blood sugar level and dehydration alone are sufficient to cause unconsciousness. It can be a little bit other type, lactacidotic coma. I didn't write it. It's very, very rare, but it's nearly the same severe situation with hyperosmolar non-ketotic coma, and it's possible in patients with severe comorbidities, in cardiovascular disorders, in patient very, very aged, after severe surgery operations, and other significant comorbidities. And mortality of this coma is extremely high too. Okay, what about history? Diabetic coma was a diagnostic problem before a late 1970s, when glucose meters and rapid blood chemistry analyzers become universally available in hospital. From this moment, diagnosis of diabetic comas become much more easy. Okay, let's stop on hypoglycemia. It is a medical emergency that involves an abnormality diminished contact of glucose into the blood. Symptoms of hypoglycemia usually do not occur until 2.8 to 3.0 millimoles per liter. Adrenergic manifestations. Yes, it is opposite from ketoacidotic and hyperosmolar coma. It is shakiness, anxiety, nervousness, palpitations, tachycardia, sweating, pallor, coldness, clamminess, mydriasis. And these manifestations are much more rapid. Usually it needs 15-20 minutes to real clinic of hypoglycemia, and patient in such period can go to hypoglycemic coma. It can be glucagon-like manifestation like hunger, nausea, vomiting, abdominal discomfort, headache. Neurological manifestations: abnormal thickening, depression, crying, exaggerated concerns, paresthesia, negativism, emotional lability, fatigue, weakness, apathy, lethargy, daydreaming, confusion, amnesia, blurred vision, automatic behavior, difficulty speaking, incoordination, motor difficult, paresthesia, headache, stupor, coma, etc. in most severe cases. That's why why if patient with diabetes mellitus, especially patients that undergo insulin therapy, spontaneously in several minutes become very emotionally labile, become aggressive, very hunger, with negative mood, it can say you about hypoglycemia level. And when patient is inconscious, it is a sign to rapidly give some glucose or something sweet drink or sweet food to this person. Or if patient in stupor, coma or unconscious, it is indication for emergent injection IV of glucose. Okay, and let's discuss chronic complications of diabetes mellitus. Most of them it is vascular complications, and we divide it on microvascular with damaging of small arteries and macrovascular with damaging of big arteries. To microvascular complication, we can name diabetic cardiomyopathy, diabetic nephropathy, diabetic neuropathy, diabetic retinopathy, and encephalopathy. And macrovascular complications, it is coronary artery disease, diabetic myonecrosis, peripheral vascular disease, and stroke. Other complications, but they are usually connected with neuropathies and angiopathies too. It is GI complications like gastroparesis, diarrhea, or constipations possible too. It is genitourinary like uropathy and sexual dysfunction. It is dermatological complications, different infections, cataracts, glaucoma, periodontal disease. Okay, main chronic complication. Yes, it is complication of eyes. It can be like retinopathy, cataract, glaucoma, and other problems that lead to blindness. It is cardiovascular problem. It is MI, arrhythmias, peripheral artery disease. It is kidney problems, and the most danger of it, diabetic nephropathy. And main manifestation and very often of peripheral artery disease, it is diabetic foot that very often lead to amputation, even in quite good treated patients. Okay, what about retinopathy? Diabetic retinopathy results in scattered hemorrhages, yellow exudate, and neovascularization. This patient in this picture has neovascular vessels proliferating from the optic disc, require urgent panretinal laser photocoagulation. According to presence of proliferation, we can divide diabetic retinopathy for non-proliferative and proliferative. Okay, what about hypoglycemia? Low blood pressure is common, blood sugar is common in patients with diabetes mellitus, but most cases are mild and not considered medical emergencies. Yes, hypoglycemia, we discuss it like acute complication, but here we can name it like in mild form in chronic complications, but with some regularities. Effects of hypoglycemia can range from feelings of unease, sweating, trembling, and increased appetite in mild cases to more serious, such as confusion, aggressiveness, seizures, unconsciousness, and more rarely permanent brain damage or death in severe cases. Okay, symptoms of hypoglycemia. Why I several times stop on this situation? Because it is much the most rapid and the most danger for life situation in diabetic patients. Yes, diabetes kills mostly for hyperglycemia, for angiopathies and neuropathies, but hypoglycemia, low blood glucose, can kill the patient in minutes. That's why it is most emergent and maybe one of the most serious situations in diabetic patients. One more time, let's stop on low blood sugar symptoms. It is shaking, it is sweating, it is anxious, dizziness, hunger, fast heartbeat, impaired vision, weakness, fatigue, headache, and irritable patient. Okay, I have no more slides for today for you, but diabetes mellitus, it is a huge team. It is even science, diabetology, yes, and it is a huge number of information about diabetes, about its complication, about especially micro angiopathies, neuropathies, different cardiovascular outcomes of diabetes mellitus. And here I show you just main of the main moments about diabetes mellitus. If you need more information, you have some question, maybe I should detailize some moments about diabetes mellitus, please write me in face group under the link to this video your comments, your questions, and possible topics to further discussion about diabetes mellitus. I will be glad to tell you something else about it. For today, that's all. Under this video, as usual, I want to see your names and groups who listen our lecture and wait you in the interesting and maybe useful discussion in Facebook group. Good luck in your education.